Are overflow incontinence treatments often ineffective? Imagine trying to empty a sink that's clogged or overfilled. That's similar to what happens in overflow incontinence, where the bladder can't fully empty, causing dribbling or leakage. This condition often results from blockages in the urinary outflow or weak bladder muscles. Treatments depend heavily on what's causing the problem, but their success can vary quite a bit. For many, behavioral strategies like timed voiding or pelvic floor exercises are the first steps. These methods help train the bladder and strengthen muscles, but often aren't enough if there's a blockage or muscle weakness. Medications that calm bladder irritability don't usually improve emptying because they target different issues. Surgery to remove obstructions, like enlarged prostate tissue or strictures, can work well but isn't guaranteed to restore perfect bladder function, especially if the bladder muscles are damaged or underactive. When other treatments don't work, catheterization often becomes necessary. Using a catheter to drain the bladder can effectively control symptoms, but it's more of a management tool than a cure. The challenge is that if the bladder muscles are very weak, simply removing an obstruction may not fully restore normal emptying. Some patients continue to experience symptoms despite treatment, which highlights how complex bladder dysfunction can be. Success rates for procedures can differ based on the individual, the cause of the overflow, and the type of treatment used. For example, surgical results may decline over time or be less effective if the patient has had prior radiation therapy or severe bladder damage. Doctors recommend a thorough evaluation before starting treatment. This includes a detailed history, physical exam, and tests like urodynamic studies to understand bladder function better. Initial steps often involve addressing reversible factors, such as stopping medications that worsen symptoms or avoiding bladder irritants. When diagnosis is uncertain or symptoms persist, consulting a urologist is important. Treatments should always be tailored to each person, with honest discussions about what to expect and the possibility of ongoing management like catheter use. In the context of bladder health and bladder cancer, it's important to remember that cancer treatments such as radiation can affect bladder function and make treatment outcomes less predictable. Radiation can cause tissue changes that impair healing and reduce the success of surgical procedures. Maintaining bladder health through early diagnosis and management of underlying issues is key to preventing worsening symptoms. Overall, treatments for overflow incontinence are not always fully effective, especially when muscle weakness or prior treatments complicate the picture. Success depends on accurate diagnosis and personalized care. Many people see improvements, but some may need ongoing interventions. Consulting healthcare professionals and specialists ensures the best possible approach, helping to preserve bladder health and improve quality of life.